Hello, this is Michael P. Hill from Phoenix, Arizona, USA. And today's topic, we're going to talk about stress testing, the significance of that and the procedure of how it's done. So basically, a stress testing is offered two ways, and it's to evaluate your heart under a prescribed, monitored workload condition. So a couple ways to do it. One, the most common is the treadmill, and pretty much everybody has walked on the treadmill, either at a gym or some sort of a fitness center. The other one is an ergometry bicycle where you sit in the bicycle and do that, but most of them are treadmills. And basically what they do is they hook up 10 wires onto your chest. They have to sound them in. They kind of have to shave the hair, prep the skin a little bit to put the electrodes on. And then they start you out on the treadmill. There's different protocols that they can use. They can start out very, very slow, 1 mile an hour, 0 grade, and walk for 1, 2, 3 minutes, depending on what the physician, usually the cardiologist, wants to see on that patient. But the normal way they start out is usually a 10% grade on it, and 1.7 miles an hour for 3 minutes. And sometimes 2 minutes. If you're doing too well, they can increase. And it goes up 2% every 2 to 3 minutes, depending on the protocol you're using. And then the speed increases, 1.7, 2.45, 3.4, 4.2, it keeps going up like that. So there's a point, if you can handle 3, 6, 9, 12 minutes on a treadmill, you're usually running at that point, and you're in pretty good shape to do that. Now, the targets that they're looking for is to get your heart rate to a maximum level. And to come up with that number, they usually use like 220 minus your age, and then take 90, 80, and 60% of that, depending on what the physician is looking for. And that's the maximum heart rate they try to achieve. Once you reach that heart rate, then they usually will do a slow down period or gradually slow the treadmill down and have you step off of it. But they're also monitoring your blood pressure while you're doing this too, to want to make sure to see how your blood pressure, if it's elevating up, systolic and your diastolic. If they start to go down, then they'll stop the test very quickly and get you off the treadmill. Now, when they do stop it, they'll lay you back on the bed where they did some baseline tracings on you. Now they'll do some post-exercise tracings for anywhere from 6 to 12 minutes, depending on what the protocol is. And they'll take recordings, electrocardiograms of your heart. So it's a really good test. It gives a lot of good information. Most of the time it's pretty accurate, but there are some false positives and some false negatives. So it's not 100% perfect, but it does give a good evaluation to see if you're having any of the pain or discomfort. So if you're walking on the treadmill at 9 miles an hour and you start having chest pain, it's going to show probably on your ECG as the doctor's monitoring that. And if they start seeing some ECG changes, elevation of the ST segment, elevating upward, to maybe where you have maybe an injury pattern being shown that you could be having a heart attack, they'll stop the treadmill very quickly, put you on the bed, and then take care of whatever's needed for that. Now, in the situation that they have to stop in an emergency, like you fall on the treadmill, there's an emergency button that they hit and it stops the treadmill instantaneously, and they'll help you up and get you onto the bed. But overall, it's a very good test. It's a safe test. It gives a lot of good information, and it's a good way to see how well you're conditioned to be able to do 3, 6, 9, 12 minutes on the treadmill. Thank you very much.